It's the little things you can't do, and it's the little things you'll be able to do that'll just make life easier. The amount of pain that she's been in, it's a lot for one person. I mean, this is how much you get in one lifetime stuffed into, they said, in 6 months.
I miss not being out of pain. I mean, it's all day, every day.
There are a lot of causes of neck pain. The causes of neck pain are often very similar to the causes of lower back pain. For instance, you have your traumatic events, falling or tripping and slipping, and that can lead to pain, of course. And then there's your more common problem, which is your mechanical neck pain. And this is a situation where you have an imbalance of forces or imbalance of pressure on the soft tissues of your neck. We're always taught with our sitting habits or sitting possibilities to sit as tall as we can, as straight as we can, but naturally our head tends to come forward quite a bit, especially with the computer work and the typing that we have to do. The head weighs about 10 to 13 pounds. However, when we have it 1 to 2 to 3 inches forward, past its neutral position, the head can start to weigh anywhere from 15 to 20 to 30 pounds. Just like if you're carrying a box, and you're holding a 20-pound box out here versus holding a 20-pound box out in here, it's much lighter and easier to hold when it's closer. So that's the effect of our forward head. And the tissue that starts to get damaged is unfortunately the soft tissues, the cartilage and the discs. They can either start to crack or fissure, or unfortunately they can start to bulge, degenerate, or herniate, leading to symptoms that can be anywhere from neck pain and scapular pain, upper extremity problems, as well as headaches. So it's similar to a lower back condition. It's got a little less weight-bearing responsibilities than a lower back, but at the same time it is very susceptible to the forward head posturing that occurs with most people when they're bending and then when they're sitting too long.
Symptoms are radiating pain into the arms or legs, balance changes, handwriting or coordination changes, or it can be things that you might not necessarily associate with neck arthritis, such as headaches and muscle spasms.
These herbs are very powerful for chronic pain, but people can actually do this simple home remedy to get some relief. So in this you have to take a 1/4 cup of raw canned sugar, whole canned sugar, and a 1/4 cup of dry ginger powder, and 2 tablespoons of pure ghee, and 2 tablespoons of ajwain seed powder, and 1 tablespoon of fenugreek seed powder, and 1/2 teaspoon of garlic paste, and combine together and make into a round ball and eat it twice a day. This removes vata and removes slowly chronic pain of neck and back.
Hi, I'm David Bacosdi, and I'm going to show you neck stretches for neck physical therapy. You won't need any materials for this. First, sitting up straight in a chair with your chin tucked, you're going to slowly drop your head forward as far as you can, or until you feel a stretch in the back of your neck. You'll hold it for about 10 to 20 seconds, and then you'll return. Keep your neck tucked, and you're sitting tall. So we're going to go into extension next. It's very important that you maintain a chin tuck, and then keeping your shoulders down, you slowly drop your head backwards as far as you can comfortably. You may feel a stretch in the front. You hold it for about 10 seconds, and then keeping your chin tucked as you come back up. What you need to do first is pull your chin back so you're sitting as tall as possible. Then turn your head to one side as far as possible. You may feel a stretch that runs down here. Holding it for about 10 seconds, and then slowly come back. Keeping your chin tucked, turn to the opposite side. You may feel a stretch on the opposite side here. Holding it, and then turn. And you can repeat that on both sides 3 or 4 times. I'm David Bacosdi, and that's Neck Stretches for Physical Therapy.
So the first treatment is going to be a chin tuck. Chin tucks are my favorite because they're easy to do, and if you've got a lot of tension in your neck and a lot of pain all around the front and the back, it's just a good way to help relax the muscles and kind of reset the muscles. So it's not a chin tuck going down, but it's a chin tuck actually going back behind you. So what I like to do is sometimes just use my finger as a target, and the reason for doing that is it helps give you an idea of how much your muscles really need to reset. So what I usually do is I just start with my finger on my chin here, and then you're going to take your whole head and go backwards, but try and keep your head in a neutral position. So not down like this, not up, just straight forward, finger on your chin, and then pulling back. So then you have lots of little chins right there. And try and hold it for about 3 to 5 seconds and then relax. And you can see usually you'll have a little space in between. I know my finger's moving a little bit, but it just kind of shows you that the muscles are resetting themselves. So just start off with about 5 of them, holding for 3 to 5 seconds. And so this really just kind of helps get rid of some of that tension in there and helps relax and kind of reset those muscles, and then relax. And then so again, total of 5 of those, holding it for 3 to 5 seconds. And then that kind of helps get that tension out of there.
The most common conditions that patient undergoes surgery in their neck for are disc herniations, which compress on a nerve and cause arm pain. Another condition, which is very similar, would be degenerative narrowing of the nerve space, either an individual nerve or the spinal cord. The primary goal of these surgeries is to relieve the pressure that is on the nerves or on the spinal cord.